everybody. So today we are going to see about the other cap bundle in HAI, which is the Clabsi. So in this session we will be seeing what are the possible causes, what would be the signs and symptoms, and what are the management for Clabsi. So what is Clabsi? Clabsi is nothing but it is central line associated bloodstream infection, and we also call it as CRBSI, which is called as bloodstream infection due to the presence of an intravenous catheter, which we call it as catheter-related bloodstream infection. So, but in this session, we are going to see about Clabsi, which is mainly due to the bloodstream infection due to an indwelling catheter, especially the central line. So, what could be the possible risk factors for developing Clabsi? The duration of central line is more than 3 days. The site would be which is more prominent to develop infection or a soil, which is the femoral site, non-tunneled catheters, emergency insertions, underlying illness, poor skin integrity, and patients whose skin flora is on high growth, such as streptococcus or staphylococcus, and patients who are not having good or may not maintaining good hygiene, which is always they having poor hygiene, and high lack of infection control practices may lead to Clabsi, which is catheter, or we call it as a central line associated bloodstream infection. So what will be the pathogenesis, how the infection is invading? So this from this picture you can get an idea that there is a sheath, or we call it as the catheter, which is very placed inside the vein and piercing through the skin. So here it is like we are going to use this sheath, and this sheath can develop some injury into the layer of the intima of the blood vessel, which can cause thrombus. So due to the thrombus there is a block, and due to the block there is high risk for infection. Or might be from an external source, that is if the insertion of the catheter is not maintained asepsis, might be contaminated infusate in case of your and we are transfusing, or when we are giving IV, if it is contaminated, that can cause infection. And whenever you go and use the exit point of the catheter, if we are not doing the hub decontamination, then there is high chance of developing infection. And also, if the skin is not well prepared prior to infection, the patient can develop Clabsi. So the possible causative factors would be Enterococcus, Staphylococcus, Epidermis, Capitis, Hemolytis aureus, and E. coli, Klebsiella, Pseudomonas, Acinetobacter, and some of the other Candida groups. So here we have given the percentage on how much influence is there on the patient's skin. So mostly due to the Staphylococcus epidermidisis, which is always present on the skin flora, there is high risk, which is showing around 33% of development of Clabsi. So what will be the common signs and symptoms? The patient will be having severe chills, fever, rigor, hypotension, which is reduced BP less than 90/40, erythema, the skin on inspection on that particular site of insertion. The catheter site would appear redness, which is erythema. Some patients may have tenderness, warmth, and swelling at the catheter site. So how we can prevent this Clabsi? Yes, as we saw in COTI, here also we are going to see how to do or maintain strict insertion techniques as well as maintenance space. In insertion, confirm the indication whether it is very much needed. Then you can plan in for using of all the sterile technique during insertion, and use the checklist whenever we insert in order to have safety checks. And we are going to use only sterile technique and maintaining strict hand hygiene, using all the full barrier precautions such as PPE, wearing the mask, and we are just preventing the contamination to the patient. And preparation of the skin at that insertion site might be we are going to use chlorhexidine, which is 30 seconds we are going to do the scrubbing time, and around 30 seconds to dry. And if it is for the femoral vein, we have to do it the scrubbing more, that is 2 minutes time and 2 minutes dry time. Secure the sutures with the sutureless devices if possible, because when we pierce the skin by using the suture material needle, then there is high chance for infection more and more. Apply chlorhexidine antimicrobial patch after the insertion has been done by the doctor, and then cover the sterile area with transparent, that is the Tagardam dressing or gauze dressing if needed according to the hospital protocol. Place the alcohol caps, sterile IV caps all over the access port, so that whenever we use, it is always in a sterile pack, and then we remove by, after doing the hand hygiene, we remove and do the half decontamination, and then whenever blood is necessary to be collected from the central line can be collected, or if you're going to go and give medicines or IV therapies or transfusions can be done in a sterile technique. Maintenance is that daily chlorhexidine bathing for all the ICU patients if they are using this in the ICU for more than 2 months, and disinfect the catheters, that is the hubs, connectors, injection ports prior to use, and this contact time would be, scrubbing time is around 30 seconds. Change the dressing over the site every 2 days for gauze dressings, and if it is for the Tegardam dressing, the semi permeable transparent dressing for 7 days. And if necessary, if it becomes very damp, loose, or visibly soiled, then we have to go in for, don't fix the timings, immediately change the dressing. Use dressing kit, mask the patient, as well as we have to wear the mask and then don the glove and do the sterile gloving technique and use the head cover so that you're not going to transmit the infection to the patient. Verify the continued need daily and at the change of shift or during the physician rounds. So to conclude, always perform hand hygiene, wear your PPE, drape the full body, and daily review whether the line is very necessary or we can remove. And optimal catheter site for selection, always avoid the femoral sites in adults. And whenever you're going to use the catheter, see that you are always performing hand hygiene and doing the scrub hub decontamination by using at least for 30 seconds using the chlorhexidine. So these are the possible assessments on Clabsi, and this is a small checklist. So see that whenever you're going with the central line checklist, all the proceedings should be on green rather than on red. And that's all for today. Thank you.